Hello, this is Mrs. Vasquez, and it is my pleasure to bring to you an introduction to the concept of evidence-based practice. This is for your nursing course 1125. These objectives were taken directly from your syllabus. I encourage you to refer to your syllabus frequently throughout your courses. These objectives should guide your learning as well as they have guided this PowerPoint presentation. As you can see on this slide, there are different definitions for evidence-based practice. Don't be confused by this. As you can see, if you look a little closer at these definitions, they contain much of the same wording. Be aware there are slight variations based on the source, and understand the basic elements of evidence-based practice. Also understand the fact that each nurse must integrate multiple acceptable sources to ensure the delivery of quality patient-centered care. So this is just an example of multiple sources for basically the same thing. Here at TVCC, we will use the definition for evidence-based practice found in your syllabus. So that is the definition that you are responsible for understanding and the one we will use throughout your nursing school. As you can see on
an attribute is a quality or characteristic that is associated with the concept that helps to clarify or confirm the concept. Several attributes of evidence exist. Major attributes of evidence include replicability, reliability, and validity. Evidence is built on research findings that can be verified if the study is repeated. Replicability That means that the results are reproducible. Evidence must be consistently and accurately measured. Clinical experience is a form of evidence and demonstrates the same treatment applied to similar patients over time leads to similar outcomes. Utilizing evidence-based practice information allows the nurse to provide individualized care. Minor attributes of evidence include that it is publicly available, understandable, and usable. Furthermore, there should be no doubt about its veracity. An attribute is a quality or characteristic that is associated. Antecedents are what precedes the concept for it to exist. Events or incidents that must happen before the concept actually manifests. A nurse must recognize the importance of research in nursing, identify problems, and have access to resources to find solutions before this concept can be fully realized. Antecedents are what precedes the concept for. The purposes of nursing research essentially are to develop the body of knowledge specific to the nursing profession and to provide research that supports evidence-based practice. Basic research, you are generating new knowledge. It's knowledge for the sake of knowing and predicting outcomes. Often, basic research uses laboratory animals as subjects. The immediate application of results usually does not occur, and basic research is conducted to develop, test, and refine theories and to generate new knowledge. Applied science, you are using knowledge to solve immediate problems, directed towards generating knowledge that will and can be used in the near future. Many of these studies focus on nursing interventions for clients and their families, and it makes up the majority of nursing research. The purposes of the goals of nursing research, basically I want to hit 4 major points here. Number 1, to promote evidence-based nursing practice. We don't want to base our practice on interventions simply because someone told us to do it, or because this is the intervention that's always been used for this problem, or because my teacher told me to. We want to choose care based on what the existing evidence tells us is the most effective intervention for our client's problem. Number 2, to ensure the credibility of the nursing profession. Historically, nursing has been thought of as a vocation and not a profession. One criterion for a profession in general is to have a distinct body of knowledge. Most valid means of developing a distinct body of knowledge is through scientific research. Nurses must demonstrate to the public that nursing makes a difference in people's health. To provide accountability for the nursing process. This is number 3. We must have sound rationale for the actions based on knowledge gained through scientific research. This is basically the proof in the pudding, or the evidence that supports our actions or our plans. To document the cost-effectiveness of nursing care is number 4, and basically it is very difficult to consider cost-effectiveness of nursing. We do so much with so little, and basically so many things that we do are intangible. But it's important that cost effectiveness be weighted basically and documented basically, especially with the increased cost of health care. Sources of nursing knowledge comes from various sources. Number one, tradition, which involves the handing down of knowledge from one generation to another and leads to actions that occur because we've simply always done it that way. Trial and error. Nurses have also used trial and error as a means of discovering knowledge. If one approach did not work, another was used. Finally, when a certain approach was found to be effective, the trial and error process ceased, and we began to use what we found to work. Scientific research, which is considered by most to be the most objective and reliable source of nursing knowledge. The best information is the evidence that comes from well-designed, systematically conducted research studies, mostly found in scientific journals. Unfortunately, much of that evidence never reaches the bedside. Nurses in practice settings, unlike educational settings, often do not have easy access to databases for scientific literature. Instead, nurses often care for clients on the basis of tradition, convenience, or the standard, "It has always been done this way." It is important for nursing policies and procedures to be reviewed and updated systematically based on the best available and current scientific outcomes. Source.
In discussing the history of nursing research, we can't leave out Florence Nightingale. The foundation for modern nursing education was derived from the military tradition, which emphasized the concept of authority. This style was a deterrent to the development of inquiring minds. Basically, the student nurse was expected to do as they were told. Florence Nightingale introduced the importance of collecting data to help make decisions about health status. Here is a quote from Nightingale's Notes on Nursing, What It Is and What It Is Not. Quote, "The most important practical lesson that can be given to nurses is to teach them what to observe, how to observe, what symptoms indicate improvement, what the reverse, which are of importance, which are of none, which are the evidence of neglect, and of what kind of neglect. All of this ought to make part, and an essential part, of the training of every nurse." End quote. As nurses increase their level of education, he or she is more likely to participate in research. And finally, we need to remember that the American Nurses Association has adopted research as a standard of professional performance.
This diagram outlines the types of research studies. Quantitative research studies are focused on testing of a hypothesis, and the results are usually reported by means of objective observation, such as numerical values. As a single study, randomized controlled double-blind studies are considered the gold standard of research studies. It is a quantitative study. The methods used to conduct this type of study introduces the least amount of bias. The patients are assigned randomly to either a group that will experience the intervention or a control group that will not participate in the intervention. Sometimes the patient knows and sometimes they don't know. The control group may be given a placebo or and so they wouldn't know. They may be given a capsule that has the same appearance as the intervention group that is receiving a medication, but the placebo does not have actually the active ingredient. So sometimes the patient knows, but in their informed consent they will be informed that they may or may not receive the actual treatment. Now, with the control group, you might also have a group of people that have no treatment at all, and so when you compare them, you will have, say, your question may be, will this intervention have an effect as compared to the same population that receives no treatment at all? So it may be worded similar to that. Now, with qualitative research, it is much different in that it is generally about a person's experience. The data collected will be narrative answers to questions. Examples of qualitative methods are ethnographic, phenomenology, grounded theory, and case reports. The results are reported in rich text descriptions, so they're going to be narrative, and sometimes we have quantitative and qualitative, both types of data collected during the same study. So we call this a mixed design in a single study, so with the same group of subjects. Now, with systematic reviews and meta-analysis, and you'll find that's at the top in the red section of your diagram, both of these methods incorporate and utilize many research studies. So basically, systematic review and meta-analysis, what you're doing is your knowledge is synthesized after reviewing and comparing multiple research studies. One example is a literature review that was completed over the use of turmeric for an anti-inflammatory. The systematic literature review was over, there were 1,000 studies that were reviewed. So there were 1,000 research studies that were reviewed before the author actually came to their conclusion. Now, with meta-analysis, it's the same way. Multiple studies are used before the information is synthesized and an analysis is presented. The barriers to evidence-based practice. Basically, Giddens notes in your text that evidence supports or disputes the efficacy of a treatment, the use of a diagnostic tool, the transmission of a disease, or any number of scenarios relevant to health care. That's on page 453 of your textbook. But additional barriers to consider, number one is research itself, or as we discussed before, our body of knowledge. Basically, if our body of knowledge or our scientific base is inadequate, then we don't have anything to pull from. Our nursing profession itself within, and such as if we have an inadequate flow of information or limited communication with each other, or collaboration between practitioners and researchers. So the researchers can be doing their thing, but if the practitioners are not finding the information, then there's a breakdown in utilization of EBP. Now, number three is organizational settings. Now, sometimes there are barriers within facilities or organizations. If the climates and resources are not favorable to evidence-based practice, then there'll be a breakdown there too. And now with practicing nurses, the ones that are basically in the they're in the clinical setting, they have educational preparation with limited exposure to research utilization, and therefore they have a resistance to change because they don't understand the rationales.
Evidence-based practice requires a systematic approach to rational decision making. Therefore, will facilitate the achievement of best practices. Using a step-by-step approach ensures that you will obtain the strongest available evidence to apply in client care. This is not a cookie-cutter process. These steps are guided by theory and will vary from author to author. Please do not be confused when you do not find one exact set of steps. Your Yoast textbook discusses the steps of EBP that have been developed and described by Larrabee. Jay Larrabee is an author and co-creator of the Model for Change to Evidence-Based Practice. Your Giddens textbook gives an excellent description of each of these steps in Chapter 46. There are other authors that essentially use the same processes but present them in a slightly different organization. The 5 steps of EBP defined by Milnick and Feinout-Overholt in the 2005 article that was posted to Blackboard for you are as follows. Number 1, ask a clinical question. Always think about your practice when caring for clients. Question what does not make sense to you and question what needs clarification. Think about a problem or area of interest that is time-consuming, costly, or just not logical. Your question may be something that is about a common practice in your facility, but you may not find it to be you may not find that it has consistent results, or you may not find it to be practical. You may simply want to find a better way to achieve your patient goals. Examples of problem-focused trends could include something like an increasing number of client falls, or the number of urinary tract infections on a particular nursing unit. Such trends lead you to ask questions such as, how can I reduce falls on my unit? Or what is the best way to prevent urinary tract infections in the postoperative client? The questions you ask will eventually lead you to the evidence and then therefore guide you to the answer to your question. Number 2, collect the most relevant and best evidence. You will find the evidence you need in a variety of sources. Agency policy and procedure manuals, quality improvement data, existing clinical practice guidelines, or more commonly, computerized bibliographical databases. Do not hesitate to ask for help to find appropriate evidence. Your facility will, of course, always be a key resource. When you are assigned to a healthcare setting, consider using experts available to use, such as advanced practice nurses, staff educators, risk managers, and infection control nurses. Step number 3 is critically appraise the evidence you gather. Perhaps the most difficult step in EBP process is critiquing or analyzing the available evidence. The critiquing of evidence involves not only its evaluation, which includes determining the value, feasibility, and utility of the evidence for making a practice change, but also we have to consider, is it applicable? We need to, when critiquing evidence, first evaluate the scientific merit and clinical applicability of each study's findings. Then, with a group of studies and expert opinion, determine what findings have a strong enough basis for use in practice. Number 4, integrate all evidence with one's clinical expertise and include the client preferences and values in making a practice decision or change. Once you decide that the evidence is strong and applicable to your client and clinical situation, incorporate the recommended evidence into practice. Your first step is simply apply the research in your plan of care for a particular client. Use the evidence you find as a rationale for this intervention that you plan to try. For instance, if you learned about an approach to bathe older adults who are restless and decide to use the technique during your next clinical assignment, you could use the bathing technique with your own assigned clients, or you could work with a group of other students or nurses in revising a policy and procedure or developing a new clinical protocol. Number 5, evaluate the practice decision or change. After applying evidence in your practice, your next step is to evaluate the effect. How does the intervention work? How effective was the clinical decision for your client or practice setting? Sometimes your evaluation is as simple as determining if the expected outcomes you set for an intervention are actually met. Furthermore, you will find yet another description of these steps in your Zierweck textbook in Chapter 24. When describing the steps of EBP, Zierweck outlines 4 steps, but as you will also notice, as opposed to a 5th step, utilization of research has been separated out as a separate process and consists of 5 additional steps. Do not let this confuse you. If you take a critical look at this, you will find utilization of research is actually incorporated in the other theories also within the 5 steps.
The most common manifestation of scientific evidence that you will encounter in your nursing career will be in the form of policy and procedure development and revision. All policy and procedures are developed and approved by a committee of professionals, usually from multiple professions within an organization. You may sit on one of these committees during your career. You may sit on several during your career. It is important that policies and procedures are once they're developed, they need to be revised as new research is presented. The most common manifestation of scientific evidence. There are many roles for the nurse in nursing research. The number 1 role we'll discuss is the principal investigator. Now, generally this takes advanced training in research, and oftentimes it's at a doctoral level. You may, at any level of education, you may be asked to participate as a member of the research team, and those roles could be something like a data collector, or you may administer the experimental intervention. Any nurse can be an identifier of researchable problems. We all have that responsibility to our clients, to our profession, and to ourselves as responsible parties. We always want to have that spirit of inquiry. We could be an evaluator of research findings. Every nurse should be involved in the evaluation process at some level. Beginning researchers basically should critique research articles. Oftentimes, the media will discuss research with sort of a lack of objectivity. It will have bias based on financial reward. We want to, as a user of research, we want to, research findings, I should say, we want to make sure that we look for research findings that have no value. And of course, when we find research findings that have value, if we don't put them to use, then they have no benefit. So we must be judicious in using research findings to ensure client safety. In research utilization, our knowledge is based on. There are many roles for the nurse in nursing research. The number one, please read over this activity. It was also in your instructions. I do want you to go ahead and complete this activity and bring it to class, because we'll finish it up during our class time. Please read over this activity. It was also in. As a student new to nursing, it will take time to acquire the skills to critique evidence like an expert. When you read an article from the literature, do not let the statistics or technical wording cause you to put the article down and walk away. I want you to know the elements of an article and use a careful approach when reviewing each element. Evidence-based articles include the following elements. The first is abstract. An abstract is a brief summary of the article that quickly tells you if the article is research or clinically based. An abstract summarizes the purpose of the study or clinical query, meaning question, the question you're asking. The major themes or findings and the implications for nursing practice. The second item is the introduction. That comes next. An introduction contains information about its purpose and the importance of the topic for the audience who reads the article. There is usually a brief summary of supporting evidence as to why the topic is important from the author's point of view. Together, the abstract and the introduction tell you if you want to continue to read the entire article. You will know if the topic of the article is similar to your PICO question. That's the question we're going to practice writing in the 4th level, so don't worry yourself with that right now. Or what we'll more likely be looking at this semester is related. Is your article related closely enough to provide you with useful information, closely enough to your problem. Continue to read the next elements of the article. Next would be your literature review or background. A good author offers a detailed background of the level of science or clinical information that exists about the topic of the article. Therefore, it offers an argument about what led the author to conduct a study or report on on a particular clinical topic. This section of the article is very valuable. Perhaps the article itself does not address your PICO question. Maybe it does, but not quite the way you desire it to. But it will possibly lead you to something else, to another more useful article. Once you have read the literature review of a research article, you should have a good idea of how best the research led to the researcher's question. For example, a study designed to test an educational intervention for older adult family caregivers will review literature that describes characteristics for caregivers, the type of factors influencing caregivers' ability to cope with stressors of caregiving, and any previous educational interventions used with families. Next, your manuscript narrative will be next. The middle section or narrative of a manuscript script will differ according to the type of evidence-based article. A clinical article will describe a clinical topic, which often includes a description of a client population, the nature of a certain disease or health alteration, how clients are affected, and the appropriate nursing therapies. An author sometimes writes a clinical article to explain how to use therapy or new technology. A research article will contain several subsections within the narrative, including the following. So these are subsections. The purpose statement explains the focus or intent of a study. It identifies what concepts will be researched. This includes research questions or hypotheses, predictions made about the relationship or difference between study variables, concepts, characteristics, or traits that vary within subjects. An example of a research question is what characteristics are common among older adults who have annual breast screening? You see, you see how specific the question is. The next subsection would be methods or design. This section explains how a research study is obtained. Explains how a research study is organized and conducted in order to answer the research question or to test the hypothesis. This is where you learn the type of study to be conducted, and that would be example whether it's a randomized controlled test, or is it a case controlled study or a qualitative study. It just tells you what type of study. You will also learn how many subjects or persons are in the study. There may be some demographics. In healthcare studies, subjects may include clients, family members, or healthcare staff. Sometimes they're the subjects in the study. The language in the methods section sometimes is confusing because it contains details about how the researcher designs the study to minimize bias so as to obtain the most accurate results possible. Use your faculty member as a resource to help you interpret this section because it can get a little confusing. The next section would be results or conclusions. The clinical and research articles have a summary section. In a clinical article, the author explains the clinical implications for the topic presented. In a research article, the author just details the results of the study and explains whether the hypothesis is supported or how a research question is answered. This section will include a statistical analysis if it is a quantitative study, A qualitative study will present a very thorough summary of the descriptive themes and ideas that arise from the researcher's analysis of data. Do not let the statistical analysis in an article stump you. Read carefully and ask these questions. Does the researcher describe the results? Were the results significant? Have a faculty member assist you in interpreting statistical results. A good author will also discuss any limitations to the study in the results section. This information on limitations will be valuable in helping you to decide if you want to use the evidence in your practice with your clients or not. Now, the final thing is clinical implication, and basically this is your final subsection. Clinical implication is a research article will include a section that explains if the findings from the study have clinical implications. The researcher will explain how to apply the findings in a practice setting for the type of subject studied. So basically, it will give you information on how to incorporate this into your practice. Nurses practice in an age of accountability where quality and cost issues drive the direction of healthcare. The general public is more informed about their own health and healthcare issues affecting society and the incidence of medical errors within the healthcare institutions across the country. We hear about it all the time on TV. Greater scrutiny is being given to why certain healthcare approaches are used, which ones work, which ones do not. As a result, evidence-based practice is a response to the broad societal forces that nurses and other health professionals must contend with. Evidence-based practice is a guide for nurses to structure how to make accurate, timely, and appropriate clinical decisions. As a professional nurse, you need to stay informed and be aware of the most current evidence. We have to stay in touch with what's new and what's best. Typically, new students will diligently read their textbooks and assign scientific articles. A good textbook incorporates evidence right into practice guidelines. All of our textbooks do, and it has the rationale and the case studies right there for us to find it right by the procedures. So that's good for us. However, a textbook relies on scientific literature that can possibly be outdated by the time the book's published. Articles from nursing and healthcare literature are available on almost any topic involving nursing practice. However, although the scientific basis of nursing practice has grown, some nursing practices are not research-based. And what I mean by that is they're not based on findings from well-designed research studies. We're using them because that is what we know. Back to that, body of nursing knowledge. Because the findings are inconclusive sometimes with the research or the practices have not yet been studied, the challenge is to be able to obtain the very best, most current information when you need it for client care. Another source of information comes from non-research evidence. This includes quality improvement and risk management data, international, national, and local standards, infection control data, benchmarking, retrospective or concurrent chart reviews, and the clinician's expertise. It is important for you to learn to rely more on research evidence than solely on non-research evidence. When you face a clinical problem, always ask yourself, where is the best evidence to help me find the best solution in caring for my clients? Though you use the best evidence available, application and outcomes will differ based on your client's values, preferences, concerns, and or expectations. I touched on this earlier. The client is always going to be our partner in deciding what is best for them, what is based on their many things. Maybe their religion, maybe their culture, maybe just flat out what they like and what they don't. Evidence-based practice does not require the nurse to find research evidence and blindly apply it to every situation without using good judgment. As a nurse, you will develop critical thinking skills to determine whether evidence is relevant and appropriate to your individual client and to the clinical situation. For example, evidence may suggest that therapeutic massage is the best practice for relieving back pain. However, your client may have cultural beliefs that prevent the use of this type of touch. You will likely need to search for a more applicable evidence-based therapy that will meet the client's needs if this case arises or something similar. Using your clinical expertise and considering the client's values and preferences ensures that you will apply the available evidence both safely and appropriately. So basically the final word on this is you are not only training to use the available research, but you're also needing to combine that and integrate it with other aspects, non-research based information. This diagram I included is from your Giddens textbook, and there is a brief description in your Giddens textbook about this diagram, but what I want you to do here is basically contemplate the diagram and see if you can understand the relationship between each of these concepts and how they interact with evidence. Ask yourself, why is evidence-based practice important to the students, to the certain nurse? Your answer will change periodically throughout your nursing school, and it'll change as you spend more and more time in the clinical setting. As a nurse in the clinical setting, either as a student or as a professional nurse, you will regularly be faced with many important clinical decisions when caring for your clients. You're going to want to know what to do. It's very important for you to be able to translate best evidence into best practice right at the client's bedside. Not only are you going to need to think on your feet, but you're also going to have to remember to incorporate the client in as a partner in planning the care. Understanding the importance of this skill and learning the skill early in your career will benefit you in practice and assist you to provide quality, patient-centered nursing care. And that's what we're all here for. So thank you very much. I hope you were able to attain a lot of information from this lecture. Please use your textbooks and the other resources we discussed, and I will see you in class. Thank you.